It was February the 13th, 2020. And the doctor walked in, told me, took his piece of paper from the health department that he had printed off, you know, kind of threw it down and said, call the health department. And I was shocked. I was nervous. I was scared. I was everything wrapped up all into one. What made me get tested was I started to get sick. I had got more sick than I had ever been in my life. I thought I was gonna die. I was so sick. And then came out of that, I lost like 20 pounds. And I was like, I really need to get this figured out. I need to know what's going on here. So it was actually the nurse that gave me a little bit of comfort. It did not come from the doctor. It was just very standoffish. It was very cold. It wasn't inviting. It was just, I left there knowing that I was gonna have to find my own way, not with the path. There was nobody there to, you know, pat me on the back and say it's gonna be okay. There was nobody saying, listen, you're just gonna take a pill a day for the rest of your life. You're gonna be undetectable and everything's gonna be fine. There was no one there to do that. When you get diagnosed with HIV, it's not just you're worried about. You're worried about the people you slept with. You're worried about your friends, what they're gonna think if they find out. You're worried about your mom, you know, your dad, everybody. You're worried about everyone because you don't want anybody to stop loving you because you have a disease that's so stigmatized. Being stigmatized is something, even in 2023, that can have a detrimental effect on everyone. And it does on, you know, physicians, physician staff, patients, everyone. And it just kind of bleeds out into the community. So you have this wall that you put up, you know, you may be gay, then you have HIV, then you have all the complications that come with that. Or what if you're undocumented and you're Hispanic and you have no social, and then you don't know how to get the health care, and then, you know, there's no insurance company that will take you because you don't have a social. Oh, and then you don't speak English.
Yeah.
And you have HIV.
Yeah.
You know how many barriers that is? So we make it easy.
Yeah.
That's why we do what we do.